Hello and welcome everyone. Good to see people still joining. My name is Michael Coleman. I am the owner of Local Health Marketing and we specialise in web and SEO for the allied health space. I had the pleasure of being on a podcast last month and being asked about digital marketing, and what I talked about was taking it up a level to marketing as a whole. And we went down this discussion around the biggest challenges and how we kind of can differentiate ourselves as practitioners. And so in today's webinar topic, I wanted to deep dive into that a little bit further. And the topic is the biggest marketing challenges facing allied health. So a while ago, I heard someone say this in a talk, and it just resonated with me. And the question was, is it possible to have two clinics in the same local area that sell the same service, yet one business does better than the other? And I believe absolutely it does. Of course it is, yes. And, do you kind of feel frustrated at that? You're not only a better practitioner, and I hear this time again that, you're more caring, more honest and trustworthy. And if that's where you are today, then this webinar is definitely for you. And the one thing that when I think about this, well, at the end of the day, no one really knows how good you are until they buy from you, until they come into the practice, they experience the customer service, they experience either yourself if you're sole practitioner or the team, and really the level of care that they were looking for. So at the end of the day, this is marketing, right? The best marketer wins every single time. And I feel marketing for allied health isn't about getting your name out there. It's more about getting that ideal patient through the door. And I think once that, and that's the big takeaway I kind of want for you guys to get out of today's session. So what I want to cover is how we can easily structure our marketing, and with a good structure, a good plan, set you guys up for success. So we'll explain how we can win, and marketing really comes down, or anything really, to action. So the biggest challenges I hear when it comes to marketing in the allied health space is, not enough new consistent patients. Like I'm hearing one week, the numbers are really good, the next week they're really low. The low quality new inquiries, so either by phone or web inquiries. Cost per new patients are too high. I'm hearing Google Ads, and I'm experiencing that too. It is really high at the moment. And then the lack of clear tracking on ROI as well. So yeah, we do get traffic from Google and all around the web, but how do we actually know the ROI on every single source, whether Google or Facebook? And the last thing is that there are just way too many options now, Google Ads, Facebook, etc., SEO, the Google Maps, all that sort of stuff. So like, where do we kind of begin? So how do we solve that marketing challenge? I feel it comes down to 3 steps, and that's what I want to talk about today. Is one, getting really clear on who you are as a practitioner and as a business. Setting up a plan for success. So there are many books out there. I've pretty much read most of them. Lots of videos and podcasts and stuff. And, I feel they can kind of bamboozle you. So what I want to try and do is just give you a real simple process today. And the third thing is just consistent implementation. I think the more we can kind of test and, trial out different copy here and there, eventually we'll get onto that win for marketing. So I want to talk about getting clear. And I feel, and I was sort of thinking, we kind of built a house 4 years ago now, and I feel building a house is very similar to planning for your business. And if we think about building a house, we get the drawings done, it then goes to an architect, the electricals are drawn up, the plumbing, sewage, etc. is all drawn up. We know exactly the type of floorboards and all the appliances, and all of that is really decided before the house is built. So we know how it's going to end. And I feel business is no different to that. And I feel if you're getting really clear on how the business ends, where we want to go, we have a well-designed business, opposed to a business where we're just at this random spot. So I was kind of there a few years ago. I built a business, we specialise in web design, and we really worked with anyone that needed a website. And the problem with this was we relied heavily on word of mouth. It was probably 97% word of mouth, and 3% would come from Google. And those people that came from Google weren't actually a great fit in the end. So the thing was, because I feel we didn't have a specific niche, or there wasn't something specific that we kind of were able to really focus on, we kind of didn't really have a marketing plan, even though we were in this game. For us to SEO and Google Ads and Facebook, looking back on it now, was just really expensive. And I feel, and I've sort of taken this step into the allied health space. So I have kind of niched down, and I'm super clear, where I want to go in 3 years. I know exactly who I want to work with, why I want to work with them. I know exactly what I can do, and it also allows me, to do marketing. So as an example, I'm doing this webinar right now. It's very much aimed towards allied health, whereas if it was general, I'd have to, obviously speak in general terms. So, I think if you are in this random spot, it's where you're kind of like, we feel like we're a bit of a generalist, we're competing against the guys next door, where is it that you want to go to in 5 years' time? Let's start there. And then once we know that, we can put together a real simple plan, and then it comes down to taking action. So what I wanted to do was just give you a real simple plan that will help you kind of set you guys up for success. After we talk about this, I encourage you to kind of put sort of like 3 boxes together. And in the first box, we want to talk about the target market. We want to put down our message to that target market. And then once we know that, then we know, okay, well, our target market's actually more on Instagram or Facebook versus Google. Google's probably more people looking for generalist type of, physios as an example, or they're actually, our target market, postnatal women. This is the message, and we know that they're on Google a lot. We know that they're in forums a lot. That's where we're going to. That's where, we can do our advertising. So in terms of the target market, and this is when the penny dropped for me, coming back to my old business, it kind of felt right at the beginning to kind of cast that wide net and target everyone. But it's actually counterintuitive, and I feel, and the reason why is that requires mass marketing. So when I was saying, we'd have to go to Google and it was expensive and all that, that was because we were bidding on terms that were like web design or web design agency and stuff like that. And those were like up to, $15, $20 a click, which we just couldn't afford at the time. So if we think about mass marketing, I want you to kind of think about Apple, right? They have millions of dollars to spend on marketing. So if we think about the iPad, which I'll get to in a couple of slides, not only do they have millions to spend on marketing, they got millions of dollars to spend on research and development to create the best product. Then they've got, the marketing budgets to last them 3 to 5 years. So we think about the iPod, they put on that extravaganza of an event. It was plastered, all over the news, which is, PR dollars. And then, we continually saw the advertising. So that Jet song was just played to death on our TVs and our radios, and now able to get the cut through there. But if we needed to get a result this year or this quarter, then mass marketing isn't the right solution, because what we want to do is kind of cut through the noise, and we want people to say, hey, that's for me. So I feel when we're running small businesses, that's really the marketing we want to do. If we had, 20 locations around Melbourne and or even around Australia, then yeah, we can look at sort of mass marketing stuff. But for local businesses, we're just really servicing 10 kilometre, 15k radius. We need people to kind of say, right, that's what I need. A physio that or an osteo that specialises in headaches, as an example. So with the target market, we need to be hyper relevant. So the best example I could think of was, if we've got heart issues, we go and see a heart specialist. Like, there's no question about it. But we're not going to go see a surgeon that also works on backs, necks and knees, right? That makes no sense to us. And so, and this is a controversial term in the allied health space because of AHPRA, but that's probably a whole other webinar. But specialists, I feel, or I think it's pretty obvious, are way more sought after, they're paid more and far more respected in the marketplace. So coming back, to a heart specialist, that fits that mold. So I think where to now is that, we have our generalist physiotherapy or osteo clinic or whatever it is. And I think if you are kind of stuck in this sort of space and this is all resonating with you, then I think you need to start to think about patients that, you're interested and excites you. Do people value that service, and are they willing to pay for it? And at the end of the day, how profitable is it for you? So, we're not running a non-for-profit here. We actually, need to earn money to put back into the business and really to grow that and to give the level of service that we want our patients to receive. So the first action item will be to look at the data and go back the last 6 months and analyse, out of all the patients you've seen or the whole clinic seen, what interests you and what excites you, or might be what interests, some of the practitioners, and then really delve into this. So do these people value this service? Yes or no? So if it's, we're just looking at back pain, do they really value this? Are they really willing to pay for it? And is it profitable? It might be that back pain, you only really need to see them 2 or 3 times and, they're all good. But say something like post, say sports physio, specialities like post-surgery rehabilitation, really excites you. The patients you see, they really value this service because they're going to get back into, playing their sport as quickly as possible. Yes, they're willing to pay for it, and yeah, it's absolutely profitable. So thinking about this, what we want to do is ask ourselves these questions. What are the trends in their life, right? So, if we think about a sportsman, they're probably in their younger years. They're fit and healthy. That's, a top priority in their life. Their goals are obviously to get back on the track as soon as possible. So if you think about this time of the year in September, season's finished, they might go get, clean up in their knee or whatever. Then their goal is really to get fit and strong before pre-season, which is only 3 months away. So, we now have, you can kind of see where this is going, right? And, what are their daily frustrations? So are they frustrated with, the way that the surgeon hasn't really explained, the rehabilitation process? Are they frustrated with the way the club's kind of handling their rehab? Are they looking for something, to really not only just really focus on fixing the knee, but educating them on other exercises or gym programs. And how do they explain this? Like, what language are they using? Do they have specific terms? Do, netballers or footballers have different terms? Golfers, etc. Like, what is it that these guys are saying or searching for that's really going to resonate with them? So when we're thinking now about, okay, we've got our target market, then we really want to come down to this message that we want to portray, right? We don't want to confuse the customer. We want to really remove those technical words from your copy and from your explanation where you can. That's what the surgeons do well. And what I feel is, you're kind of getting paid for making that complex situation as simple as possible, right? So we know what they've done. We know that they've done the knee. We know it's like a complex rehabilitation. We know that there's a lot going on in their minds and in their body, and it's really overwhelming for them. So how can we kind of simplify that for them? And at the end of the day, I've read this a lot in marketing, and I don't know what the age is. It's like I've heard 6, I've heard 12, so I just picked 10. But can a 10-year-old understand that? And that example of Apple and the iPod, their slogan was "puts 1,000 songs in your pocket," and it's just so simple. There was no we have 2 gig of memory and X processor and the level of sound quality is ABC. There was none of that. It was like as simple as 1,000 songs in your pocket. And at the time, like, iPod didn't revolutionize the MP3 player, or like there were Walkmans and Discmans and all this kind of stuff already before it. They just came on, simplified it, made it look really good, and a lot of marketing really got that over the line for them. So the other thing I also want you to think about is, if you were to, like, say, glance at your website now or your competitor's website or whatever, and you switch out the logo and you change the name to something generic, like, I feel they all have the same message. So getting super clear on your message and differentiating yourself is really the key here to getting that win. So with the message, we really need to have a message that has an offer that converts. So this happens when we know our target market and we have a powerful message. So I feel the easiest way to kind of jot down the message is the elevator pitch. I know it's like been around forever, and when we hear that, it's like, oh, the elevator pitch there. But it really does work. And the thing is, we want to start with the problem. So the problem is, we know you're struggling with your knee rehabilitation. We know you need to get fit and strong before pre-season. What we do is, we do this, we get you back onto the pitch, or we get you back in the game, and this is how we do this. We do this by taking you from the massage table into the gym, and the results are, we see most people, we've got to be careful with the language here, but we see people come back stronger than they were before their surgery, if that's the case. So you can see that, okay, right, I've just had my knee surgery. Wow, they're not like my normal physio that's just, massaging my knee or whatever it is. They actually take me into the gym, and I'm now able to get back on the track quicker. That's going to draw me in to your clinic. So having sort of thought about that, and as you kind of jot this all down, we can now come back to our digital marketing, and I've just kind of had this sort of bird's eye view for a while now that I present in most webinars. But now that we know who our target marketing, who our target market is, what that message is, we look at our brand and we can look at our logo and it's like, well, does that represent it? Yes or no? Do the colours represent sport, or is it, was I going for something different back in the day? What was my strategy, and what's my strategy moving forward? If we are concentrating now on sports rehabilitation, can we actually go out to different sports clubs and schools and such and start to educate them on the importance of, if it is getting back in the gym or building up strength, what is that, sort of strategy now? And then the creative is like, okay, well, we probably need more photos of, guys in the gym and, coming back, we know we're targeting netball or football, whatever it is. So we need that, creative to be there. And then at the end of the day, our email marketing, all of our social media, our SEO, online advertising becomes super clear for us. So we might say, okay, well, instead of spending, all this money on paid search, what we want to do is, rather than go after, physiotherapy, Melbourne CBD, we want to go after knee rehabilitation, sports, injury rehabilitation, and we're happy now to go wider net. So before, when we were bidding on Physiotherapy Melbourne, we probably only wanted like a 5k radius, but now that we're actually focused on this, people are going to be willing to drive 15, 20k to come and see us because, we have the solution that they need. And then we're able to then, look at Facebook as well and be like, okay, cool, let's do knee exercises. Let's, talk about the knee. Let's talk about the different surgeries. We can talk to different surgeons and get them, to help us. That might be through a blog post or, write some, maybe share something on social media, whatever. And then it just becomes really clear. We're not having to do that mass marketing where we're spending, hundreds of dollars a month. Or thousands of dollars a month, and we're not really sure whether there's an ROI. It really becomes super clear now when we can kind of assess this. So planning ahead, I feel the first thing you want to do is audit your data. So if you're using Clinico, jump into Clinico or whatever system you're using and analyze the data. So it's literally just take out a pen and paper, write it all down. Who are our common customers that you really want to see, and are they profitable, yes or no? Once we know this, write an elevator pitch. Keep this really short and sharp, and like I said before, make sure a 10-year-old or a 12-year-old can understand that. And then now you can start to put it into action. So go to your homepage and maybe just tweak that messaging, or create a dedicated page to your new audience and, tweak that messaging. Select one platform. So coming back to the Google Ads or even Facebook, but I'll talk about the Google Ads. Maybe pause a couple of those campaigns that you're running that are targeting, the certain regions, and let's go with the sports injury rehabilitation. There might not be as much search, but we know that we're not going to spend as much money, but the guys that are coming, or the girls coming to our website from that search, we know we have the solution that they're looking for. Or in Facebook, you can set up some target audiences that are targeting, sports enthusiasts. Might be CrossFit, it might be AFL or netball, whatever. Update that target audience and have that messaging and really just test that out. And then that's all it really becomes now, is testing. Okay, did that work, yes or no? Okay, let's come back to the messaging, come back to the elevator pitch. Let's try this, try that out for the next month. And the thing is, really know your numbers. There's another thing I read a while ago was, the numbers you focus on are really going to, help you grow. So if we're looking at these numbers every single month, every single week, we know, okay, well, we've had a dip this week, and well, actually we know why, because we had a different set of Facebook ads running. What worked the month before? Let's go back to that and maybe tweak that again. And so you can tie it all together. So that's pretty much it. There's a lot more that I could probably talk about around this topic, but I kind of wanted to keep it really short and sharp and make it really simple for you guys. But yeah, we're, like I said, an agency specialising in, I guess, more than just web and SEO, but where I feel we differentiate ourselves is really to help you kind of dial in that elevator pitch and also the target market. So we do that by kicking off the strategy, asking you 100 questions about who you are as practitioners, and then getting to the core of that, and then obviously help with the web and the SEO and the Google Ads, and really help you down a path. So I hope you took something out of this. I would love to